My name's Dr. Ben, and I'm on my way to meet with Mrs. Martinez, who's been referred to me by several doctors for a possible case of amnesia. They've run several tests on her, but have found no physical illness and believe it to be a mental one. Mrs. Martinez? Mrs. Martinez?
Who's that?
That's your name.
No, it's not.
What's your name?
I can't remember.
Well, my name's Dr. Benton, and I've been referred to you by several doctors. They said that they ran some tests on you and couldn't find any physical illness, but they believe you might have a memory problem.
I never went to the doctors.
Well, do you remember what you did this morning?
I came here.
Why are you out here?
I don't know. My husband brought me here.
Mrs. Martinez, your husband passed away in the car accident last year.
What car accident?
The car accident that you were in last year?
I wasn't in a car accident.
Well, in your file it says that you and your husband were in a car accident and he passed away, and ever since then you've been having memory problems?
They don't know about my past.
Well, what do you know?
I don't even know about my past. How could they know about my past?
Okay, well, as it seems to me that you have a case of dissociative amnesia, and tomorrow, if you would come to my office, we can do a psychoanalytic therapy for you. I'll come to your house and pick you up, okay?
Okay, that sounds good.
All right. Good morning, Mrs. Martinez.
Good morning.
Thank you for coming in today. To start off your treatment, we're going to have you close your eyes and try to relax. Take a couple deep breaths. Take another one. And at the snap of my fingers, the memory of your car accident and your husband are going to come back to you. 1, 2, 3. What is your name? How old are you?
27.
What's your husband's name?
Carlos Martinez.
And what happened that day of the accident?
My husband was driving with me and my daughter in the car. She was 2 years old. There was a truck passing. He was looking at her and he didn't stop at the stop sign.
And then what happened?
Then we crashed into the truck and he died. My daughter died.
And do you feel any guilt because of that? Because you didn't tell him about the truck coming, or you didn't have a seatbelt on?
Yes, I felt guilty because he was looking at me when he shot at the stop sign.
Okay. And do you remember anything after the accident?
No.
You don't remember going to the hospital?
Yes.
Do you remember waking up and seeing your mom and dad and family members around you?
Yes. And I remember calling for my husband. He didn't respond.
And then in your file it says you went through a little bit of a depression.
Yes. I'm still going through it.
And the depression of the memory of the car accident is helping you to forget it and move on.
Yes.
Okay. When I snap my fingers, you're gonna wake up and you're gonna remember who you are and where you are and everything that's happened to you in the car accident. And the guilt is no longer with you. 1, 2, 3. Welcome back. What's your name?
Martinez.
And how old are you?
27.
And what's your husband's name?
Carlos Martinez.
And what happened to him?
We got in an accident.
And do you feel guilty about it?
Not anymore.
Do you remember what you did this morning?
Yes.
What did you do?
I got this. You picked me up and came to your office.
Okay. Do you remember your daughter's name?
Yes.
Do you feel guilty about her death?
I couldn't save her. So no.
Okay, thank you.
What's your name?
My name is Kathy.
And how old are you?
I'm 17.
And why are you here?
My mom thinks, I don't know. She thinks I have a problem, and I think I'm fine, but, like, whatever. She wants me to be here.
Alright, and what's your daily routine?
I get up, go to the bathroom, wash my face, get dressed. I'm homeschooled. My mom took me out of school, so like just go to the dining room. Just, I don't know. My mom teaches me, so kind of just chilling all day.
And who are your close ones?
My dog, Tom, because I mean he's nice to me, you know, and like I'm homeschooled, so like I don't really have school friends, except when I like kick him and like yell at him, because sometimes he's a dumb dog. Like sometimes he's just really stupid, so I get angry and I like kick him across the room.
And are you motivated or anxious more than usual?
I don't know, just I guess anxious. I don't know, like.
All right. And do you have a lot of energy?
Yeah, like I don't know, like I've just been like so like I don't know, happy I guess.
Yeah, you seem to be shaking. So
Yeah, like I don't know, I'm like in a good mood. I've been like in a really good mood the past like week or so, and it's like I haven't been able to sleep because of it. So I don't know. It's my mom's like really worried because last time this happened, like I crashed and it was really bad. I was like really depressed for like a couple days and stuff.
So that explains your sleep patterns by it decreasing, correct?
My sleep patterns will decrease because I'm not sleeping.
All right. And are you irritated or agitated?
Well, kind of don't want to be here, but you know, it's whatever.
All right. And are you in a blue or depressed state?
No, not now. I'm pretty chill right now.
Have you been?
Yeah, I have before.
When was the last time?
Last time I was like really happy, and like I don't know, and then I got like really depressed and sad, and I was like, I still wasn't sleeping when I was really sad, and it was just like I felt like worthless and hopeless.
And when was the last time this happened?
Like last month. It like happens like every month or two. Like I like get really happy and I get like really sad. So.
All right. Are you experiencing behavioral changes?
I mean, I said I'm like happy and then I'm sad. Like obviously.
All right. Have you had any recent conflicts that are out of the ordinary?
Oh my gosh, this girl cut me off at Walmart. She took my parking spot. Oh my god, I was so mad. So I like got out and I started like yelling at her, and then I might have punched her, but no one saw it. So, but she took my parking spot. So I was like, dude, like, what the fuck?
So you did punch her.
I'm not saying anything. Maybe.
So what would you put that as your behavioral changes?
Yeah.
All right, we're gonna keep an eye on you because it seems like you have a bipolar disorder with all the questions you answered.
No, I'm good. I'm chilling. I'm fine. I'm not. No.
We're gonna come see you tomorrow to correct all of this, and you can come back in here to find out what the issue is.
But I'm fine.
Hi, how are you?
I'm good. How are you?
Good. So how have you been?
Fine.
Well, I have a new solution for you.
Share.
Well, there's these mood stabilizers called the typical antipsychotic. And
Oh, so I'm crazy now.
I'm not saying
I'm
you're
crazy.
I'm not saying
I'm crazy.
No need to cry, Miss Benton. No need to cry. You just take it twice a day, and it's going to treat and prevent highs of your maniac and hypomaniac episodes, and your lows depressive episodes, and it minimizes the effects or... Are you even listening?
Yeah.
It minimizes the effect or mood status of function at social situations. So here you go.
So
And I want you to call me in a couple of months to let me know how it is.
so I need to avoid grapefruit.
Exactly.
All right. Is that all?
And that's it.
Appreciate that.
No problem. Appreciate you.
Thank you.
Thank you. Have a great day.
Take these, ma'am.
Goodbye. Hi, my name is Dr. Magna Martinez, and I'm here because I did a study on Kathy Benton 3 months ago being diagnosed with bipolar disorder. We had her on medication, mood stabilizers, and she's being treated now. We're going to find out how she is after 3 months. Here she goes. Hello?
Hey, Dr. Martinez, how are you?
I'm good. How are you?
I'm doing great, actually.
How's the medication? Is it doing better?
Yeah, my mom has noticed a big change. I've been sleeping a lot better. I haven't had any major mood swings or depression, and I just been really good. My family's seen a really big improvement.
Wow, I'm glad to hear that, Kathy.
Thank you. I just want thank you so much for helping me, and I hope to live a better life now.
Thank you for coming.
Yeah. All right. Bye.
Bye. Be safe.
Mary,
And how old are you?
20.
I'm gonna ask you a few questions if that's alright.
Sure.
Do you feel like people are out to get you?
I feel like because of my brain and how I can, I can see things sometimes, and I know so a lot. I feel like the government watches me. CIA is gonna come get me maybe, and they have a chip in my brain, and they're using my mind and trying to control it and everything. Yeah.
Do you think someone is controlling your thoughts?
Yeah, I feel like the government. When I was in the place for people like me, they put me to sleep for a little bit, and I think they put a chip in my brain, because I get really bad headaches sometimes, and it's it's from that, and they're trying to control my mind, and
Do you hear someone talking to you and no one else can see it?
yeah, I hear I had this friend at the place. Her name was Evelyn. She was really nice, and we she brought me ice cream, and then we went, and then I left, and then I came back, and then we hung out, and she she moved to Switzerland though, so that was really sad. I miss her, but she was a lot of fun to hang out with, and then I would take a nap and stuff.
We looked at the records and there was no Evelyn in the hospital.
Yeah, that's what they said, the doctors and stuff said, but I mean, I know I saw her, and they probably just didn't want me to, I don't know. She was special too. She could hear and see things I could see, and I guess they just didn't want me having friends, because the doctors there they're really mean, and they're not there to help you. They're here to make sure that you don't reveal any secrets that you might know about, the government, stuff like that.
Yeah. So do you go out often?
No, I like to stay in, because since I know so much, and I feel like people are trying to kill me. I don't want to, I don't want to die yet.
And do you see your friend often?
Yeah, Evelyn. I've seen her a couple of times, but she moved to Switzerland, and yeah, we one time she was visiting me, and the government came in, and they tried to take her, but we ended up just going and hanging out at the mall, and then afterwards we went to the movies, and then during the movie I left though, and I had to go I went to the bathroom, and then I was back at the place, and then I took a nap, and then I ate dinner.
Alright. What do you do on a usual day?
I do something normal people. I just I hang out and, you know, do stuff like a normal human being. I'm normal. I sometimes see things that other people can't.
And what are the relationships with their family?
Well, when I would wake up in the middle of the night and start talking to like my friends, my mom would get really scared, and I guess the family doesn't really hang out with me anymore because they're scared of me and they're scared of like what I see, because people are scared of what they can't see, and I can see it. I tell them it's okay. Well, some of my friends are nice, but other ones aren't.
And how was your childhood?
It was good. I like when I was like 17, I guess I tried to kill myself one time, and it was really bad because I felt like my thoughts were like racing and I couldn't get control of them. So I was like, oh, I'll just like kill myself, because I was like that was like what it made sense. And I tried, but like it didn't really work. And then like I went outside and it was like really sunny, and like I saw a shadow, and then like I saw like a halo over my head, and I was like, oh, look, an angel. And but I'm kind of tired now. Like I don't want to talk anymore, and these windows they're like open, and I feel like people are like watching me. So
Are you sure?
Yeah, I'm gonna go. Bye. Hi, my name is Mary, and I was a patient of Dr. Martinez for schizophrenia. And 6 months ago, I was very off and disorganized, and my mind was racing and everything. And I've been in a new treatment center as suggested by Dr. Martinez, and the system, it's really been helping me with cognitive therapy. I have alarms set to eat and to remain clean, personal hygiene, and we have like when I feel like I'm getting distant from others or being antisocial, I'm pushed to talk to people and to just get out there and just not be quiet. And it's been really helping, and my family and friends have noticed a big difference. My thoughts are more controlled, and I'm more sane and normal, and I'm really thankful for everything that has happened and the therapy I've been going through. And yeah, I hope to continue my treatment here.
I'm Dr. Martinez, and we are here to do a case study on Sheila Whitman. It has been said by her friends and family that she might have an OCD problem. We would do such experiments as make things out of order to see how she reacts to it. Here we go.
Welcome. Take off your shoes now, please. Please. Hurry.
Hey, how are you?
I'm good. How are you? Come this way. Just let me fix these tassels. Here. No. It has to be straight. 1, 2, 3, 4. 1, 2, 3, 4. No. Okay. It's okay.
I'm
Happens.
sorry. I didn't mean to do
It
that.
happens all the time. 2 inches. 2 fingers. Okay. Hello. Stop it.
Hi, what is your name?
Sheila Whitman.
And how old are you?
I'm 27.
And what am I here for today?
Apparently there's, getting checked out for, what was that, OCD, but I'm fine. I just like things a certain way, and I'm not really a big fan of germs, as you can see.
So the gloves are for the germs?
Yeah, I don't like germs. I got really sick one time, and it's just, It was really bad. So just I wear these just to be safe.
Do you think it's normal?
Yeah, plenty of people wear gloves. You know, it's not a big issue. Yeah, I keep a can of disinfectant spray just in case. You know.
And an extra pair of gloves?
Yeah, you know, you can never be too careful. I mean, only if I need it though. But you seem like a clean person. I don't think I need it.
I appreciate that. So why are you shaking?
Oh, there's this thing like 1, 2, 3, 4. 1, 2, 3, 4. It's just like number 4 is like a big thing. Like I don't know, I just like things in 4s. Like 2 and 2 is just perfect symmetry. Oh my god, go. Oh god, I need to go wash my hands.
You have gloves on.
No, I need to wash my hands.
Are you okay now?
Yeah, try not to do that, please. Like, looks like I'm gonna have to put these on.
It's allergy season, I'm sorry.
Yeah, I know, that's why I stay inside. I don't like the pollen and all of that. No. Okay.
So do you think you have a problem?
No, I think it's just being precautious, you know. Just like anybody else.
There is such thing as too precautious though.
Is there? I mean, what happens if someone sneezes on you and you like contract a disease and it's just, if you were, you know, if you took your shots and your medication, you wouldn't have to worry about getting sick.
So tell me more about this sickness that you had when you were a baby.
Well, I was actually, I was on the playground one day and some kid just, you know, kids are just, they're disgusting. He just came up and just sneezed right in my face and it was gross and he had green stuff coming out of his nose and then he like wiped it with his hand and wiped it on me thinking it was funny. It was disgusting and I screamed and I ran away. And I got home and my mom said I had a fever and then we went to the doctor and I had I had like flu and I had it for a long time and it made me so sick and ever since then I promised that I would always be cautious about, you know, being healthy and safe.
Well, I think you have a problem.
No, I don't think so. I think I'm normal. I hate this couch. The tassels never stay the same way. See? 1, 2, 3, 4. 1, 2.
I think you do have OCD and I think your family and friends were right.
No. I think I'll be okay. Just just 3, 4. Sometimes like it's 5:21 and at this time I go around each room and I spray 4 times to make sure there's no germs. Just to be safe.
So how much money do you spend on cleaning products a year?
A couple thousand actually. I have mops, Swifters, I have tons of hand sanitizer, hand soap. I use only like what doctors use to like make sure they're sterile. And you know when you get your blood taken, that disinfectant stuff they put on your arm? Yeah, I have some of that too. And sometimes I just dip my arms in them. and I pull them out. I do it every night before I go to bed. I do it 4 times. And yeah, I think, I don't know, I don't like dirt or germs or anything that's not symmetrical.
Alright, so we're gonna come back tomorrow to have proof on that you have OCD to make sure you know what your problem is. And we're gonna have a solution and a cure for you.
I mean, I don't really think I have it, but okay.
Alright, thanks.
Good morning, Mrs. Martinez. How are you today? What brings you to my office?
I'm having sleep problems.
Like what?
I haven't been able to sleep in 2 months.
2 months. Wow. Did anything happen to you? Did it make you feel like?
About 3 months ago, I got held hostage, and I don't want to talk about the rest.
Well, talking is the only way you can ever really.
I
Relief.
don't trust you.
Okay, I understand. Well, let's I'll start. I have a few questions for you. This traumatic event, have you been having repeated distressed memories or dreams about it?
Yes.
Care to share?
I still don't trust you.
Okay. Do you avoid activities or places that remind you of these horrific events?
Yes. I stopped going to Spanish restaurants.
Do you blank on important parts of it? Like, do you remember the?
I remember every single part.
Do you have a loss of interest in significant activities in your life?
Yes.
Do you feel detached from people?
A lot of people.
So, describe to me your daily routine.
My daily routine is I get up and I quit my job because of the horrific accident. So I just stay at home with my mom since she knows what happened.
What does your mom do for you?
She supports me. She talks to me.
So you talk to your mom about this?
Yes.
Do you think she could come in and help us with this issue?
If that's necessary. Probably my dad could come.
Oh. Okay. Why don't you feel that you can trust me?
I just met you and I stopped trusting a lot of people.
But you contacted me because of
For my sleep disorders, now my horrific accident.
Yes, but if you're not sleeping because of these horrific accidents, I need to know so I can help you.
Well, like I said, I was held hostage and raped by the cartel. And a lot of flashbacks keeps coming back. And every time I try to close my eyes, I just remember everything. So I just rather not sleep.
Okay. Well, Miss Martinez, have you felt depressed? Are you depressed and sad?
Yes.
Okay. Do you feel disinterested in life or guilty that it was your fault, maybe?
Yes.
Do you have irregular eating habits?
Yeah, I hardly eat now.
Do you have night terrors? Do you have you wake up screaming in the middle of the night?
Yeah, constantly.
Okay. Well, Miss Martinez, from what you've told me, I would have to say that you have a case of PTSD, post-traumatic stress disorder, due to your unfortunate event with the cartel. And I will get back with you tonight about further treatment and therapy options for you. So thank you for coming in today.
Thank you.
Mrs. Martinez has come in for 18 sessions for cognitive behavioral therapy for her post-traumatic stress disorder. Hello, Mrs. Martinez.
Hi. I really appreciate all these sessions, Miss Glenn.
Have you been sleeping better?
Yes.
So,
Now that we've gotten through the trust issues, would you mind telling me about what happened to you that night?
I just feel like it's all my fault.
And why is that?
I had a bikini top on because I was in Miami for spring break, and I had these Daisy Duke shorts on, and I didn't know what to do, so I just went to the Spanish restaurant to ask for directions to where to go for the Puerto Rican parade, and it just all went downhill from there.
What happened once you got into the restaurant?
Once I got into the restaurant, there was a group of Spanish people, and there was these men saying that they could take me to wherever I want to go. With no gas money, no nothing. And me being naive, young and dumb, I went to go, and I wish that never happened. If I would have never been wearing that, if I would have known where I was, if I would have been with a friend, it would have never happened.
Now, just because you're wearing that doesn't make it your fault. There's a lot of girls that walk around in Daisy Dukes and bikini tops, and they don't get raped.
I just happened to because I had it on. If I didn't have that on, if I had jeans and a long sleeve shirts in a 90-degree weather, I wouldn't have gotten
No,
what came to me.
It's not your fault. They shouldn't have done that to you. That was on them, and they shouldn't have done it to you. It's okay, Mrs. Martinez. Let it out. Can you continue on with your story?
Then he took me to this warehouse, and all I saw was red bars, and he roofied me. And him and his friends just started gathering. I don't know who he was. They all had a mask on. They all had the same exact clothes. They all had black clothes on. And I didn't know who was who, and they just started traumatizing me, punching me, kicking me, all of this, because he thought I was somebody I wasn't. He thought I was the daughter of this drug lord that I didn't even know. I didn't even know there was a drug lord in Miami.
See, that means it's not your fault. They were mistaken. It was a mistaken identity. It was not your fault. What else happened after they beat you?
Then the one man, he took me to the back room and took all the little clothes I had on off, and just did what he did. I don't want to go into detail about that.
It's okay. You can let it out. Continue. What else happened?
And then after that, I don't know how, but a man came in there and found out what they were doing to me, and I was saved, and my mom was wondering where I was at, my dad was calling all around, and that was the end of that. And then ever since then I've been having bad dreams, bad time to sleep, bad thoughts.
Okay. Well, it wasn't your fault. I just want you to understand that. Just because you were wearing what you were wearing doesn't mean that you were responsible for what those men did to you. It'll be okay. It's okay. It's okay. It's okay. Let it out. It's okay. It's okay. It's okay. It's okay. Hi, I'm Dr. Benton, and I'm here with my patient, Magdalene Martinez, who has recovered from her post-traumatic stress disorder.
Yep.
Tell us about that.
I am able to sleep again. I'm not having no more insomnia. I'm happy. I'm having wonderful relationships and healthy relationships with my family and friends. I've never been this happy thanks to Miss Benton.
Thank you. We use cognitive behavioral therapy with her, and she just talked about her feelings and the situation and understood that it wasn't her fault, and we got through the guilty emotion, and she accepted the fact that it happened, and she said, she forgave them, and she's okay now.
I'm 100% normal.
Okay, well,
Forgive and forget. Thank you.
With the air, like I don't care, baby, by the way.